Good morning, everyone, and welcome to the CORE webinar. This is an overview or introduction of the Comprehensive Outcome Research and Evaluation Reporting System. Welcome, everybody, on this Tuesday morning. I have just a few slides to go over with you about some basics, and then I will spend most of the time in CORE. If you have any questions as we're going, on your panel on the right-hand side of your screen, you do have a little question area, and you can send those in as we're going, and we will be monitoring those as we go. All right. So those of you who are brand new to CORE, CORE is a web-based application for treatment courts and diversion programs across the state. Its main goal is to meet DOJ's evaluation purposes and also for performance measurement for sites. It is not specifically a case management system, though it is very close, and we've been getting a lot of feedback from sites on what they would like to see as far as changes, and we do take those into consideration for future development. So it doesn't have things like scheduling or case notes in there, or any sort of fund tracking or payments or anything like that. So if you are not familiar, the treatment courts have a performance measures document that DOJ and some stakeholders put together along with the National Center for State Courts. It is currently targeted at drug and hybrid courts, so we do have plans to expand it to other types of treatment courts. And we made sure that all those data elements are in CORE so that you can track your performance measures, and we can provide reports on how programs are doing, and so you can look at your outputs and outcomes in more real time. CORE does collect some information at the event level, current level, which you will see once we get in there, such as status hearings and drug testing. And really the goal is to provide a consistent mechanism so that all programs throughout the state can be evaluated and look kind of at apples to apples so we can see how the programs are doing. Data collection is emphasized in the Wisconsin Treatment Court Standards as well as national standards. We know that programs have better outcomes when they look at their data, and we do request that data be collected and entered into CORE within 48 hours of gaining that information. Otherwise, the quality of the data does go down. And we will be discussing data quality just a little bit as I'm going through in areas where we've noticed some common issues or concerns. I will point those out as we're going through. Also, if you have any questions, any of the people on right now that I know are CORE users, go ahead and throw those in as we're going. So we do suggest you use Chrome as your browser. CORE works the best when using Chrome. It does work in some newer versions of Internet Explorer, I believe, but we do highly, highly suggest using Chrome. For new counties that don't already have a Memorandum of Understanding or MOU, we do require that MOU before anyone gets access to CORE. The MOU is between DOJ and your county or tribe at that level, and that's just because of the sensitivity of the data collected within CORE. Same goes for participant consent forms. Most programs do this already, but we do ask that you are being sure that any of your participants you're collecting data on do sign consent forms before you enter their data into CORE. We have example consent forms for you if your program doesn't currently have one, and those are out on CORE, or you can ask for them and I can send them to you as well. Sites can only view their own data, So if you only have access to, say, Milwaukee County, you're not going to be able to see Walworth County's data unless you've requested and gotten approved for access to Walworth County. We request that you do not share usernames and passwords in CORE, please. It is individual based. Everybody that needs access to CORE will get their own username and password. If you need to change your role in CORE, maybe you added another program to your county, or you're no longer with one program and you're with another program, you just submit a user request form, just like when you're starting out and you need new access. In addition, when you no longer need access to CORE, or there are people in your programs that no longer need access to CORE, that is the responsibility of the sites to let us know and submit that CORE removal form, which is under the Resources tab in CORE, just to make sure that people who no longer need access to some of that sensitive data information, we can get those deactivated as soon as possible. There are currently 4 different roles set up in CORE. There's the site admin, the program admin, and the program user, and then report user. The site admin is going to be responsible and oversee the role access for everyone in your particular county or tribe. There can only be one site admin per county or tribe, and that needs to get approved by whoever signs your MOU for your county or tribe, usually the county executive or county board chair. And this is the person who will sign all CORE request forms for users going forward, and is also the one who gets all of the emails and notifications regarding CORE or any data quality concerns that we have going on. The program admin is responsible for overseeing a particular program within a site, and there can only be one program admin per county or tribe. So if you have a drug court, you can only have one program admin for that drug court. You can have as many program users as you would like per program. This is set up on a program basis again. And then report user, you can have as many of those as you would like, and how that's different from all the above is the report user won't have access to enter participant level data, and they won't be able to look at participant level data. They will only have access to run aggregate level reports. Checking the questions here. Doesn't look like we have any yet. All right. When you first get your username and temporary password from CORE, it needs to be changed within 72 hours. Otherwise, that temporary password will expire. If you don't hit that 72-hour mark, go ahead and give us a call or email the CORE box, which is at the bottom of the website, and I'll show you that here in a second. And we can send you a new temporary password. In November, we started doing what's called multi-factor authentication upon login. So this is very similar to probably other systems you have, like your banking or anything like that. Once you log in with your username and password, you have to enter a code. It's a numeric code that will be sent to you based on how you set this up. And this replaces, for our current users who are on today, the challenge questions that we used to use. We no longer have challenge questions. It is just this multi-factor authentication code. We highly, highly suggest when you first set up your multi-factor authentication that you use the app on your phone, and that will give you a code. You do have the ability to set up to come via email or via SMS text message as well to get your code. If you have any issues with that or any concerns with that, again, please shoot us an email, let us know, give us a call, and we can go through that with you, but the instructions will be right on the website when you log in. If you do get locked out because of that token, or if you get logged out or locked out because of misentering your password, again, shoot us an email, give us a call, we'll get you unlocked. There are ways to prevent getting locked out of your password, such as just clicking on the Forgot Password link. And I can show you that once we get into Core here. So in addition to the individual role requests, we can also set up program types. So in order for you to set up a program type, your site admin submits a program request form, and these are just some of the examples here of the different treatment courts and diversion programs that we currently take and that Core is currently set up for. If you have multiple types of treatment courts that fall into one of these categories, for example, multiple adult drug courts, then we will ask for a more specific name to give your program. For example, a couple counties have a court specific to opioids or heroin. So more or less, you technically have 2 adult drug courts. So one will be listed as your adult drug court, if that's what you want, and then the other one will be listed as your heroin court. So just please be specific when you're asking for access to Core, what program you need access to. And also, if you ever have any changes to your programs, please do let us know. For example, if you are an adult drug court and your county decides that you want to then take OWIs into that court as well, and you are going to become a hybrid court, please let us know so that we can get the hybrid court set up with you in Core and that you're not entering all your new participants under that same program. I'm going to go over most of these when we get into Core, but just kind of an overview as far as broad data collection. There are required fields in Core, so fields that we absolutely request prior to you moving on to a page. And it would be good once you get into Core to kind of take a look and see what's required. That way, if it's not currently in your work process or workflow to have this information, you can figure out ways amongst all your partners to get this information and figure out the best way to do that. Where we could, we added as many drop-downs as possible for consistency purposes, and we will talk more about that in a bit as far as using what's in the drop-down or using the other option. There are data validations built in for data quality purposes. For example, you can't have a birth date that's after an arrest date. Someone can't be admitted to your program, after their first drug test, things like that. We do have as many of those in place already as we can, but do help us in looking at your data to be sure what you're entering is accurate. And then lastly, we just ask that you get to know your data. This is really the data for your particular program, and it's your people, so you should know it better than us. Use the reports that are in there, and also if you ever have questions on what is in there for your program, let us know. We can run any reports for you that you'd like or get any of your data back out that you would like. Just shoot us an email and we can get that to you if the report that's currently in Core does not cover it. And then review research and data from other programs as well and other evaluators to see what they're doing. Okay, so I'm going to pause there for just a second and pull up Core and see if we have any questions. That's all I had for slides. All right, perfect. Looks like no questions as of yet, so we'll keep rolling here. This is the log on screen to Core. So before you even log in, I'm going to show you a few things on the login screen. Down here in the lower left, you will see our contact information. So if you ever need to call us, our number is right here. and then the email address to email us with any questions or issues that you might run into. We also put some useful links down here to the National Association of Drug Court Professionals, WATCP, the Wisconsin Criminal Justice Coordinating Council link, that sort of thing can all be found here down at the bottom. And then next to the username is a forgot username link. If you click on that, it will just have you enter your email address. And then if you go to the forgot password link, that will send you a new temporary password, or you'll be able to change your password. So that's what you can do if you think you're at risk for getting locked out. If you've tried logging in a couple times and it's not let you, to prevent yourself from getting locked out, I would suggest clicking on that forgot password link. All right. And every time you log in, it is going to ask you to check this box, look at the terms and conditions. If you haven't done this already, please do look at it at least once and read through it. And then you will click login. So I already have my authentication set up. So this is what it looks like when you do have it set up already. It'll ask for that token. So once you log into Core, if you only have access to one program, you'll automatically be logged into your dashboard for that program. But if you have access to more than one program or more than one site, then you'll have drop downs like you see right now up at the top. So you just navigate to the program that you want to log into, and then you'll be taken to your dashboard. And then once you are logged in, you can view and manage your profile and change basic information in the upper right-hand screen. I need to move my webinar navigation here. So under View and Manage Profile, you are able to change basic information such as your name, your email address, if that changes, your phone number. The only thing you're not going to be able to change is what role you have, so the access that you have to your particular site. That's something you'll, again, need a request form for. But other than that, you can go in and manage your own profile in the event of any email address changes, name changes, etc. Also up in that right-hand corner is where you can change your password. And when you are getting close to your password expiring, there will be a red notification that pops up next to your username here, and it lets you know you have 15 days, and then it counts it down every day for you when your password's about to expire. So that's where you can go to change it. And then this is also where you can log out. Go back to the dashboard here. All right. I'm actually going to go right to left when talking about your dashboard here. So on the right-hand side of your dashboard, you have a list of recently accessed participants. This will give you the last 10 individuals that you were in their record for. And anywhere where you see these light blue, that means it's a hyperlink, so you can click on it and go directly into their record. And then the navigation pane keeps getting in my way. The abbreviations next to each name is an abbreviation for their status. And if you click on the little question mark, it will tell you what those abbreviations stand for and what that status means. So if you look at that first one I have there for Eric, it says RU. That means he's referred under review. And then the triangle with the exclamation point, that means there is incomplete information for that individual that needs filled out prior to that person's discharge. So as I mentioned earlier, Core does have required fields that need filled out. before you can move on from entering more information on that person. Core also has what we call incomplete fields, or that will get flagged. So the flag if incomplete fields, you'll always know from this triangle with the exclamation point. And that just means more or less that it's required prior to their discharge, but not required at this particular point in time. So in the middle of your dashboard, you have a couple different reports. Up at the top are going to be counts of individuals that are kind of in current status, so who haven't left your program. So the referred, under review, pending admission, active, etc. are all going to show up here. And then again, anywhere there's a light blue, it's a hyperlink. So if you want a list of everyone who's currently referred and under review in your program, you can click on that, and then it will pop up a list of those people. And then you can just return to your dashboard if you'd like. And then at the bottom is a list of everyone who's no longer in your program, so they kind of have closed out statuses. So if they were found ineligible, if they declined, and then all the different types of discharge statuses, such as graduated and terminated. And then it gives the count for year to date and then program to date. And again, if there's information there, there'll be a light blue hyperlink. And statuses change on their own. It's not something that you have to manually change. Statuses change based on the workflow in Core, and I'll show you that once we go in there and start entering a participant. So for example, once you enter someone's admission date, they become active. Once you enter a discharge date, they become pending discharge. It's all based on your workflow in Core. On the left-hand side is what we call the Core search. This will search people who are only in the program which you're currently logged into. So right now I'm logged into the Test County Adult Drug Court. If I do a search on my dashboard under this Core search, it will only show me referrals that I've entered into the Test County Adult Drug Court. If I have access to another program, then I need to go to that program to search for those individuals. So this is a way to get to your people you've already entered if they are not one of your last 10 accessed participants. So those are the three main columns on the dashboard. I'm going to pause for a second and look at any questions. All right. And I should have mentioned, I apologize. If you don't know what SID is, it's the state identification number. And then a Core ID is the 6-digit numeric number that Core will give your referrals. And I'll show you that once we enter a referral. Up at the top of your page, you will also have a Resources tab. And under that, on the left-hand side, is a Contact Us. It will automatically fill in your information. You just have to tell us what your question or comment type is. If it's a data-related question, it will get sent to the Bureau of Justice Information and Analysis. If it's a grant or program-related question, it will get sent to the Bureau of Justice Programs here at DOJ. In the middle of the resources, we have our frequently asked questions and then just some resource documents for you, such as the treatment court standards, the performance measures, which I highly suggest taking a look at if you've not done that yet, and then all of the forms that you need when you're requesting new users. On the right-hand side are forms that are fillable PDFs for each page that's in core. So depending on your workflow, if you have anybody that is going to not have access to core at the moment, but you want them to be able to fill out information to maybe do data entry later, you can select these forms here. I'll just click on the personal information one, for example, and it will pop up a PDF form of what's needed for that page in core. So one of these exists for every single page in core. So this can be useful if you have someone that just does drug testing for you, but they don't need access to core or something like that. All right, and then one last thing before we move on to entering a new referral. I just do want to point out that under the documents, under the resources, we do have a core reference guide. So if you have any questions, I would take a look in there. If your question is not answered in there, always feel free to reach out to us. We can try to get your question answered. All right. So core is referral based. So what do I mean by that? I mean that you enter an individual per referral. So if someone is referred, I'm just going to use adult drug court because that's what I'm in right now. If someone is referred to your adult drug court and maybe they get terminated and then they get referred again, you enter them again. So it's not person based. You don't enter the person one time and then enter multiple referral dates. You enter that person for as many times as they're referred to your program. So to enter a new referral, you will go to a new referral up at the top. And then there are a couple different ways that you can start this process. You can either search somebody by their state identification number, the ATN, which is their arrest tracking number, or if you have some of their demographic information, such as race, gender, date of birth, you can enter that information here. So what this is doing is this is searching the criminal history database. So especially for diversion programs, you might not always have people with a record in here yet, and that's okay. So if you enter somebody and they exist, they will show up here, and you can either click on them, and that will bring up a record, and it will auto-populate their basic demographic information. So the reason we do this is that we can have consistent names, date of birth, demographics, and that sort of thing to eliminate data entry errors. So this makes it more consistent and makes it more accurate as when we try to do recidivism analysis and that sort of thing. If a person doesn't have a record in here, or you think you entered the correct SID number or information and the correct person's not showing up, you can always start a completely blank entry by just clicking on the button down here. Or if the table doesn't bring back anybody, you'll always have the option to just enter new referral here. And when you do that, it will open up a blank record. And I do suggest doing that core search on your dashboard before you enter a new referral to help you eliminate duplicates, to be sure that you didn't already enter a referral for that person or that somebody else in your program didn't already enter a referral for that person. So once you are in somebody's record, on the left-hand side here, you'll see that it's divided up into kind of three main categories. There's referral and information, referral and admission information, progress updates, and then discharge information. All of these are currently grayed out because the person hasn't been admitted. Once someone's admitted, you'll have access to everything after admission. But because some people never get admitted, those are currently grayed out. To spare you from watching me enter a bunch of data, I'm going to go back to my dashboard real quick and go to somebody who is new, newer but already has information entered. Okay. So a couple basic things here. You'll see that the first name label is bold and it has an asterisk. That indicates this is a required field. So if that wasn't there, and I tried to save this page, I would get a red required error. But if you have everything required on that page and you click save, you'll get the green thumbs up. That means everything on that page is good to go. I do want to point out down here that we ask for identifiers. If people do not have a state identification number, there is a no state identification number box right here, and you just click on that if there is no state identification number. If there is no state identification number, we do request that you fill in at least one other identifying number, such as their social security number, which does get masked out. And the reason that we ask for this information is so that we can connect individuals to other systems and other data, such as when we do our recidivism analysis. So I know a lot of people had that question, and that is the reason. It's for when we do our evaluation. So the first time that you save this demographics page for a person, that's when this core ID will get generated. And that core ID is specific to that referral for that individual. So Eric has this core ID for this particular referral. Again, if he gets referred to the program another time, he will get a new core ID. And then next to the core ID, it says referred under review. This is his status, and this will get changed as we go through. In addition, there is a little person icon, and it's light blue, which again should indicate to you that it's a hyperlink. And if you click on that, it will pull up a case summary for that participant, which I will show you when we get to the reports. I'm going to just pause real quick about questions. Okay, to answer that identifiers question, give us what you can, depending on the data agreement that you have with that individual, that might not be an option for your program. But do feel free to reach out with particular instances like that. It's not always going to be a one-size-fits-all. And if you don't have a particular identifier, you can always enter unknown. And anywhere where you see these little question marks, that's what we call our hover help. Those will tell you what to enter when something is unknown. In most cases, it's going to be a -99. Okay. So those are the required fields. Again, the bold with an asterisk. Those flag if incomplete fields I was telling you about, where you can move on from a page without filling them out, but you can't discharge a person, those are just going to have an asterisk, like this did right here. And then as you can see over here on the left-hand side, there's already information entered for this person, and you can see that on these screens, there's that triangle with an exclamation mark. So that just shows you that before this person gets discharged, he has further information that he needs to fill out. Okay. So after the demographics page, there's just an alias page. So this is where you can enter any aliases for that person. We've had a couple instances where the search brings back what the programs determine to be an alias as their main name. If you do have identification and know what their legal name or date of birth is, go ahead and change that main name and then put the alias in here. All right. So the first referral and information page is going to ask basic information about the particular referral. So things like the referral date and the referral source, so who referred them to the program and at what point they're getting referred to your program. Is it pre-plea, post-plea, etc.? And then down here it asks for their case information. There is currently only room for one case, so we ask that you pick the case that most appropriately applies to why they're being referred to your program, or the charge that most accurately reflects why they're being referred to your program. If there's multiple, use your best judgment, use the highest charge, whatever makes the most sense for that referral. So there is a CCAP search on this page. So if you have a court case number in the county, you can search CCAP and it will auto-populate the charge information here. So I'm going to go ahead and just enter one so you can see what that looks like. This is what it looks like when you pull up that CCAP search. So this is an example of where this case had multiple charges. Pick, again, whichever one makes the most sense for why they're being referred to your program, or the most serious charge. So if you click on that, it automatically populates the statute and felony class, that type of thing. I'm going to go ahead and save that information. Successfully saved. So here's again an example. Everything required, such as the referral date and the referral source, is filled out, so I was able to save the page and can move on. But you will see that I have this triangle with an exclamation mark over here. That's because there are these fields that have an asterisk here, such as their arrest date, that I didn't fill out. So before I discharge somebody, I'm going to need that information, or it's not going to let me discharge the person. It will just be stuck in pending discharge status. And then one of the last things asked for referrals is criminal risk and needs information. We are aware that different tools have different scoring outcomes and have received a lot of feedback on this page. And we do have plans to make changes. I just unfortunately will say it's not going to be anytime soon. So if you have any questions on how you should enter your risk needs information for your particular tool, if it isn't clear to you on here, please reach out and we will help you with that the best we can. So on this page, it asks if you have a pre-screen tool, and then it has two different areas for their risk needs assessment. And if you don't do one, you can just click no or unknown if you're not sure. I'm just going to click no right now for the purposes of moving on. All right. And then the last screen that you'll have to do for a referral is the eligibility determination screen. If someone declines participation to your program, just check that box and the date and then tell us why. If someone doesn't show up to their assessment or you can't contact them, that's when you would click no show or did not start program. And then for eligibility, you would click that eligibility was not determined, unless you did make an eligibility determination for them already and you did determine they were eligible or did determine that for one of these reasons they were ineligible. But simply not showing up would not make them ineligible. You would put not determined. So this is one area where we've seen some data quality concerns that we have. So I just do want to point that out. If the only reason, more or less, that you said they were ineligible was because they didn't show up, put not determined for their eligibility. If there were other reasons they were ineligible, please choose from one of the boxes or multiple boxes. We have all the different CAD requirements on here, such as, past violent convictions and things like that. They are on here, but if there's something not on here, there is an other checkbox. Go ahead and click that and then enter the reason for other. This should be used as sparingly as possible, but if you find yourself constantly needing to enter other here, and this goes for anywhere in core, any of the drop downs where you're constantly choosing other, please let us know so that we can consider adding a checkbox or a drop down option that meets your needs. All right. So if someone declines your program or is found ineligible, that's as far as you will go in core. So as you can see, this person right now is referred under review, but I just marked that he declined the program. So I'm going to save it and just show you how that status automatically changes. Oh, see, I didn't put a required field in. So now it is declined participation, and it will show up on the dashboard under your declined participation under the summary. So here he is. I'm going to pause real quick and see if we have any more questions. If a person declines to sign a form for you to collect their data, then you are not able to collect their data. Some programs make it a requirement for participation. In regard to the pre-screen question, if you're using that module as a pre-screen and it is a true pre-screen, then you enter it under the pre-screen. If you're doing the full risk needs assessment through Compass, then you would enter it under the risk needs assessment, not the pre-screen. So someone asked, what if someone is being offered a short jail sentence and so they don't want to do treatment court just because it'd be longer, and the person is still interested in treatment but they're declining to participate? So yes, this would be a declines to participate. I would pick inconvenience or lifestyle as the reason, or yeah, I would pick inconvenience or lifestyle for the reason for that, not interested in treatment. Those are two separate ones. And I think in the future we will be adding a box that has something like that, the shorter sentence. When we were doing our kind of looking over some of the data for reasons people declined or were found ineligible, things related to jail and sentencing were brought up a lot. So you probably will be seeing some changes there. Yes, everyone who is referred to your program should be being entered into CORE if you are a TAD-funded site. So CORE is required, if I didn't say so already, sorry. CORE is required if you are a TAD-funded program. If you are not a TAD-funded program, CORE is not required, but you're certainly welcome to use it. And yes, if you are a TAD-funded program, the expectation is you are entering every single referral to your program. If you have a transfer from another treatment court, is it a new referral, or does the other county's info track into your case? It is a new referral. It is a new referral for your program, and under that referral page for point of entry, there is an option that says transfer, and then on the program that they are coming from, transfer is a discharge reason. So they will discharge them from their program in CORE, the reason being transfer. Where do you find what point of entry is for your client? It just depends on your program type. You know, are people coming to you pre-plea, post-plea? It varies program to program. Someone's asking if I would pick bail jumping over possession of meth. That's really up to you. Again, pick what makes the most sense for why they're being referred to your program. Sure, I can show you the drop down for some of the pre-screen tools. So the ones we have in there right now are the pre-screens for Compass, the LSI-RSV, and the proxy. If there are other pre-screen tools that are consistently being used, please let us know so we can get them added. And then for the full-on risk needs assessment, this is the list that we have right now. And then later on, I will show you, we also have a place for the alcohol and drug screen as well. If a client is not interested in your program, am I saying choose lifestyle, not interested in treatment? It depends on the case. It's a case-by-case basis. The particular person that asked this question said that they were interested in treatment but didn't want to participate in the diversion program due to the sentence. So in that case, it would be inconvenience to lifestyle. If you have a person that isn't interested in treatment, then yes, definitely put not interested in treatment. To the person asking about the point of entry, can you please be more specific? I'm not real sure what your question is here. Here are the options, if that helps. It's just when they're getting referred to you, how are they coming in? At what point in their process? Okay, that is it for questions at the moment. I think I grabbed them all. If not, go ahead and ask it again so I don't miss it. Thanks. All right. Yes, it's at what point the referral is coming in. It's at the point of referral. Okay, so once you enter somebody and they are found eligible, and then you enter their program admission date, all of these admission pages will open up in blue instead of gray. That lets you know that you can then click on them. I'm not going to go through every single page. You can kind of get the idea looking at it, but I am going to touch on a few particular areas where we see concerns or they're just really important for us. So the first one under the admission, if you have an active participant, is the administrative page. And if you're a drug court, this is the only field that you have. If you're a diversion program, you'll have one other field on here. But the funding source is very key. So anybody can use CORE. So this field right here is the only way we know if your participant is being funded with TAD funds or not, is if you select the treatment alternatives and diversion under funding source. This is when we do our evaluations and run reports. This is the field we use to determine if somebody is TAD funded or not. So this is very, very important. So please be sure that if you are a TAD funded program and that particular individual is being funded by TAD and you're not using other funds, which is completely fine to do if you want to get around some of the TAD statutes once in a while. You can definitely, not use TAD funds for a particular participant. But if most of the time, if you are a TAD funded program, your participants are going to be TAD funded. So please make sure that you're checking this box. Someone's asking about the location of the substance use assessment and its location. It's under alcohol and other drug use because not everyone does that full assessment prior to entry. And we also located it with the other information under alcohol and drug use that you might not have on an individual unless they are admitted to your program. You can check more than one funding source. Yes, of course. What are the requirements for a participant to be TAD funded? Can you be a little bit more specific? I guess I don't know what you mean by that necessarily. If your program is TAD funded, then the participant is TAD funded. Unless you're making a point to take a participant with like a violent history or something, and you're adjusting who their case manager is, etc., or how they're testing. This is going to be a different answer for every single program, unfortunately. So I can't, without more information, answer your question because everybody has different funding for their program. What they fund is completely different. Some people use their funding solely for staff. Some people use it for their drug testing equipment. It just really depends. So if you put a little bit more information down there, we can hopefully answer that question for you. After the administrative page, we ask information about family and housing. So this is where it's going to ask for things such as marital status, number of children, so that we can look at some of these basic identifiers and information when we do evaluation. So you'll see that the admission information and the discharge information is very similar. We kind of ask for these things at admission, and then we ask for them at discharge. So when you're answering all these admission questions, the intent is at the time of admission, this is where this person's at. And then when you answer them at discharge, the intention is at the time of discharge, this is where this person's at. We also ask for education and employment. So highest education level, are they currently employed? You'll see here is an example of entering unknown. So the number of hours worked per week. If you hover over it, it says enter -99 if unknown. So if you're ever unsure what to enter for unknown, always click that hover. Most of the time, you'll have a drop down where it says unknown, so it won't be an issue. There's nothing really on here I think that I need to point out. There's also a criminal background page, so this asks for things such as age at first arrest and the number of priors. The medical and mental health page is where you will enter their mental health assessment information, if they so have one. And also if they are on MAT at time of admission. So there are validations built in for MAT, and I see a lot of errors for this. We get a lot of questions on this field. It's at time of admission. So when you are in the admission section and it asks for MAT currently, it's are they on MAT at time of admission? It's going to use the admission date you put in when it's validating other fields. Yes, there are certain crimes that make a person not eligible for TAD funds. Absolutely, yes. I will connect you with someone that can help you out with that and provide you with some information on what statutes would fall under those categories. After the medical and mental health page is the alcohol and other drug use page. This is where that AOD screening tool and AOD assessment tool come up. If you don't use a screen tool, just put not screened if all you do is the full assessment, and vice versa. Also on this page is where we ask for the primary drug of choice and when they first started using drugs and alcohol. And then the last page under the admissions section is everybody's favorite, even ours, responsivity and treatment motivation. This got carried over from a different screening tool and a different data collection system, and we completely understand if some of these questions seem odd. If you don't have the information, go ahead and put unknown. We may consider taking this out at some point in time, but for now, do please go ahead and enter these. The majority of people wanted this left in. To the person asking about the specific statute, it would depend on what the person was charged with. I'll be sure that information, I'll send a follow-up email after the webinar with that information that we have that helps guide you as to what qualifies as a violent offense. I'm making a note right now. Yeah, you're welcome. What do we mean by documented alcohol or drug abuse history? As, you know, have they gone to treatment? Okay, I'm going to pause there just for a second to see if we have, does anybody have any questions about the admission information? And then I'll move on to progress updates. Any questions regarding referral or admission? I'll take a quick pause here. All right, I only see one more question that came in regarding referral and admission, and that is about filling out the mental health information. I would only fill this out if you have an assessment, if you have the paperwork. And you're not going to be able to fill out the diagnosis code and all that if you don't anyway. So no, it is not self-report. To clarify an earlier question about individuals not filling out a consent form, I would follow up with us. Please send me an email about that as far as their participation in the program. I don't personally know of any programs that let people not fill that out, so we could talk about that. It is a requirement of the TAD program that we get information on individuals who are being TAD funded. I know there were a few people prior to CORE that were then entered into CORE that didn't have consent forms filled out, and what we ended up doing with them was just entering basic demographic information so that we would at least have the numbers correct, like they would show as an admission to their program, but we didn't use their real name or date of birth. We entered unknown fields, so we might do something like that. But it's gonna be a case by case basis, so please shoot me an email or shoot an email to the CORE box and we'll discuss it. Okay, I will move on to progress updates then, but as you have questions, feel free to keep entering those down into the question box. And again, I'm not going to go through every single progress update on here, but I will point out where we have seen some issues, and then where there are some differences between progress updates. Just looking at another question here, 1 second. Yes, thanks, Renee. I'm not sure if everybody can see that or not. In case they can't, Renee and our Justice Programs Bureau is just providing a bit more clarification on the funding source. Programs that use county funding in addition to TAD funding, and they can ensure that all services associated with supporting that participation of a violent offender, they can check other source for that funding or whatever source of funding they're using. So yeah, you can definitely still enter them into CORE. Just don't check TAD funded. If the program and most of its services are fully TAD funded, then you can do that. All right. So all progress updates are entered essentially the same. So I'll just click on the first one, which is alcohol and drug testing. And I know that it seems a little bit daunting at first when you get to the progress updates section in CORE, but do remember you're not going to be entering participants' data like this all in one go like I'm doing right now. But if you do want to track your performance measures, most of the performance measures fall under the progress updates section in CORE, because it looks at drug testing, incentives and sanctions, status hearings and that sort of thing. So if you want to be able to track performance measures for your program, then yes, the answer is yes, you do need to enter them then. For our evaluation purposes, we look more at admission and discharge, but as far as the performance measures, that's where a lot of the progress updates come into play. So every single progress update screen is going to look like this. You're going to have a table with all of the progress updates that are entered under that particular service. There's none entered right now. To enter a new update, you click on the plus button up at the top, and then it'll enter a pop-up for whatever information is needed for that particular update. So this is alcohol and drug testing, so it's asking for the drug test date and the test outcome. We've been looking at some of this drug test data lately, so a couple things I do want to point out here is for test outcome. If someone is in jail or there has been inclement weather and someone was originally going to be testing, but more or less you're not expecting them now to show up and it's excused, please pick excused from the drop-down. If you do not expect them to be at that test, pick excused rather than other, please. If someone shows up late or misses a test, that would fall under no-show if you're going to consider that a positive test. If you go ahead and let them test, then by all means enter, whether it was negative or positive. If a person tests positive for an authorized substance that they're allowed to have, then go ahead and pick that the test was negative. No unauthorized substances were detected. If you're considering them to have an authorized substance, and that is okay with you and okay with your program, negative means that no unauthorized substances were detected. So that would not go under other, it would go under negative, no unauthorized substances detected. I'll go ahead and enter a test here just so that you can see what it looks like once it gets added to the table. It shows up down here like this. And then you can go back into a progress update by clicking the edit or view button next to it and add more information in as you get it. So in addition to your typical alcohol and drug tests, such as UAs or PBTs, we also have a section that is only for continuous monitoring. So this is where if you do scram bracelets or transdermals or remote breath testing, this is where you'll go in and enter that because it's handled differently. So you don't have a particular test date. You will enter when they started monitoring and then when they end it. And then the only dates you'll enter is if they have non-compliance with it. The difference between the two negatives is sometimes people send a test to a lab and do a confirmation. Does that answer your question? So positive unauthorized substances detected is if it's just the original test, and then the one that says confirmation positive, not just positive, would be when you send it out to the lab. The next progress update is ancillary services and requirements. This is where you're going to put things in such as NA and then any sort of non-required community service that wasn't part of a sanction. That's where you'll put the community service, any educational classes, life skills classes. All of that falls under ancillary services. Yeah, if you have a question, go ahead and put it in the box, please. Everybody is muted on the phone, so you're not going to be able to talk. And then we have a section for inpatient and outpatient treatment services. So you'll enter the date of the referral, and then whether it was an individual or group session, and then the type. So you'll enter all of their treatment sessions here. We have started having programs hit the max out number of sessions. It has now been increased to 500 from 250. If you do max out at 500, you'll have to enter right now another referral. So it'll be a duplicate referral and then enter more sessions if you hit the max 500 sessions. All right, looks like a lot of questions are coming in, so I'm just going to pause for a second. I'm sorry, I don't know what that acronym stands for about your ancillary services question, so I can't answer that. Can you spell it out, please? I will show you the sanctioned community service in just a moment. Housing and education under ancillary services means if they take a class, like an education class. We can look into that about the end date on continuous monitoring, but I don't see that changing, no. No, all of these contacts and services aren't required to be entered, but if you want to be compliant with the performance measures and track your performance measures, you're going to need to enter them. For your comprehensive community services program, it depends on the service that you're providing. If it's a general service, it kind of sounds like it would be an ancillary service, yes. If it's a formal outpatient treatment, then it would go under outpatient treatment. No, I would never use self-reported information for that. You're just essentially taking someone at their word that they attended, right? Someone's asking for drug testing. Do you go back and change the outcome if you send it to a lab? No, that would be considered a separate test. That's why that confirmation is there. Or at least the way that you particularly phrased that one. Okay. So if you want to track someone's medication-assisted treatment, that is also under progress updates. And it will just ask for the date started and then the date ended. And the type and then how it's discontinued. So again, this is where I'm seeing a lot of errors. People are putting dates that aren't consistent with how they're answering the other questions about MAT. So if someone is on MAT at the time of admission, this is where those dates are going to come into play. It's going to validate against those dates. So if you said no and then are trying to enter a MAT date that's before it or something like that, it is going to throw up an error. For status hearings, it'll just ask the date of the status hearing and then if it was attended, and that is one of the performance measures. And then same for supervision contacts. I did get a question recently about collateral contacts. Those would not count. This is contacts with your participant for formal supervision. All right, so that's contacts and services. I will pause there. Any questions on progress updates under the contacts and services? A contact with a recovery coach or sponsor? No, that's not a supervision contact. Yes, it's a probation appointment. That would count. And for more information about things like that, you can look at the performance measures document or the core reference guide. Okay, it looks like there's not any questions anymore about the contacts or services. I will go into incentives and sanctions quickly. They look very similar. Again, to add one, you would just click on the plus sign, select the reason for the incentive, and then what the incentive or incentives were. And this is what we use to calculate the ratio of incentives to sanctions for performance measures. Okay, someone asked if a client is in jail but shows up via Zoom, would they be entered in incentives? I'm not sure I understand that question. Sanctions. Go here. And someone asked earlier how to enter community service given as a sanction. When you enter community service as a sanction, it will ask the number of community service hours ordered right down here. So hopefully that answers your question. So that's where you would track sanctioned community service. Someone's asking about entering contacts with participants. Is it just formal supervision? Yes, the purpose of the supervision contacts progress update is for a formal supervision appointment. It's not asking about case management or things like that. It's formal supervision. And again, the performance measures document can explain that for you as well. You're certainly welcome to track that information for your own purposes if you'd like, just not under the supervision contacts. You could maybe do that under an ancillary services or something like that. Someone's asking if every time a client shows up for a status hearing, do we always have to add an incentive or sanction? If an incentive or sanction takes place, yes. Which should hopefully be happening during a status hearing. If a participant receives a sanction for a violation and at the same hearing also receives verbal praise for something else, are we supposed to enter the incentives and sanctions for the same date? Yes. As far as your coordinator and case manager contacts not being supervision contacts, it really depends on on how your program is set up. I'm sorry, I can't answer that for you specifically without more information. We could have a phone conversation follow-up or email follow-up later. It's going to depend on how your program is set up and what you do during those meetings. It's not a one-size-fits-all for everybody. Okay. I think I'm caught up on questions here. The next progress update that we have is in-program recidivism. So this is where if you want to track people who receive a new charge or new arrest while they are in your program. And this is another spot where you will see that CCAP search. So when you get that new court case number, you can enter that in here and it will auto-populate that new information for you. And then the last section of progress updates is other status changes. So this is where you can, if you so want to, track changes in education and employment. This is where you will do phase changes. Also, I want to show you the inactive periods. So if you have someone who is going to not be participating in your program for a period of time, but they are not discharged, you will enter that here. And so when we do time in program or active time in program, or do, days of sobriety and that sort of thing, if you don't want them to be counted as active in your program for a particular time period, that's where you will enter this information. So if you have someone that is incarcerated based on a different case for a period of time, if they have a medical issue where they're going to be out and not actively participating in your program, that's where you would enter this. If someone has a medical issue or is incarcerated or is in inpatient treatment, but you do consider them to be actively participating in your program and still making contacts or, Zoom status hearings, or you're expecting them to check in for drug testing, that's not considered an inactive period. All right, someone asked if we have a person who is terminated from the program and got new charges, the program is not letting me close him because he doesn't have a sentence yet. How do I close him out? I'm sorry, I'm not sure. I would need more information from you as to what you mean it's not letting him close you out. Okay, I'm going to pause there for 1 second. If there's any questions on progress updates or anything prior to progress updates, please go ahead and ask. Or if there's something I haven't answered for you that you would like answered, please go ahead and ask now, and then I will get to discharge and reports, and we'll be done. In my follow-up email about violent offenses, I will also include information for you about in-program recidivism. I'm getting some questions about that, so I'll just send information out to everybody to answer that question. Okay, someone's asking about the sentencing outcome question at discharge. Yeah, if you don't have the information, then you would put unknown. There is not currently a testing environment in CORE at this current point in time. Okay, I'm going to mute you and sneeze real quick, and then we'll go on to discharge. All right. So someone's asking, if you don't have conviction information, how do you enter that information? If there's any information you don't have and you're unable to get it, you can always enter unknown. Okay, under discharge, there are just a few pages, and most of them should look similar to admission again. So under the administrative page at discharge, asks for the discharge date and the discharge type. The current discharge types are administrative discharge. This is going to be things like if someone dies while they're in the program, or if they have a medical issue that makes it so they can no longer participate. That would be an administrative discharge. And then graduation, termination, transfer, and voluntary withdrawal. If they are terminated, we have several checkboxes here for why they are terminated. For the person asking about the conviction information, please send me a follow-up email separately, and I will take care of your particular issue at an individual level. So the administrative page at discharge is, simply asking for the discharge date and then the reason for the discharge. And then it is going to ask on the next page for family and housing information at the time of discharge. So this is just, again, will you enter their information such as marital status and where they're living. But this time you're answering at the time of discharge. Same with education and employment. And then the medical and mental health page at discharge is much shorter than at admission. It just asks about current prescribed medication and current MAT information. And again, see a lot of errors here. This is asking for whether or not they are on MAT at time of discharge. So under that progress update of MAT, if the dates do not accurately reflect what you're answering to this question, that's when you're going to receive an error, and it's going to look at the discharge date and then the dates you entered that they started and ended MAT. So that's how it's validating. But if you have any questions, feel free to send an email to the core box or go to that resources page and enter a question there. And then the last page is status and outcomes. So this is where you're going to put the case outcome for the case that they got referred to your program on. So more or less the carrot for entering your program. Did they get a reduced sentence, reduced charges, etc.? I don't think there's really anything in particular on this page we see a lot of errors with or that come to mind right now. Can anyone submit an application to TC? I'm assuming TC, you mean treatment court? Can anyone submit an application? It would depend on what your eligibility criteria is for your particular program in your county. All right. So once you think you're ready to discharge a participant, as you can see, this person is currently in pending discharge and is not completely discharged yet, even though we did enter his discharge date and type. To actually send him into a completed discharge status, such as his graduation, so graduated status, you have to go to the discharge confirmation page. And it will tell you that data entry for this participant record is complete. He's ready for discharge. We can hit confirm discharge. Yay. You can see he is now graduated. Now, if I did not fill out necessary information for this person prior to discharge, so that flag if incomplete symbol there, and I tried to discharge this person, when I go to discharge confirmation, it's going to tell me that the person has missing data. So that's where that triangle and exclamation point comes into play. Again, you can go through all the different screens in core, but you're not going to be able to actually discharge this person until you fill out that information. So that's where this symbol comes into play here, and it will tell you on what page you have that missing information so that you can go back, fill it in, and discharge the person. I'm going to pause here for any questions. That's all I have for you as far as entering participant data. I'm going to show you a little bit on reports, and then we'll have time for questions and be done. All right, looks like there aren't any other questions at the moment. All right. So we have a couple reports out on core right now, and depending on what your role access is, you might see different reports. So when you go to the reports tab up at the top of your page, you will be directed to our reports screen. And on the left-hand side, the reports will be divided into program reports, participant reports, and administrative reports. So you will not see the administrative reports unless you are a program admin or a site admin. The only administrative report we have out right now is a user summary, and that will tell you who all has core access to your program. So this will be useful for you so that you can keep up on who may or may not need access to your program, so that you're making sure you let us know when someone no longer needs access to core for your program. Any of the reports that are under program are going to be aggregate reports. So just total counts about the people in your program. It's not going to be individual information. So people who are report users will have access to those reports. And then anything under the participant reports will have individual level information. So only program users and admins will be able to see those, but not report users. So what you do when you click on a report is you may see things that look like this. So these are just the different parameters that we set for that report so that you have some control over what you want to see. So for the program admission report, so this is going to bring back information on your admitted participants. You need to enter an admission date, a start date, and an end date so that the report knows for what time period are you wanting to look at. So do you want to know about everyone admitted in your program in 2020, for example? If so, then you would enter January 1st of 2020, to December 31st of 2020. If you just want to look at people who were admitted in your program in 2020. That's what that admission date means, and it's the same with discharge. When it asks for discharge dates, it's just asking, who you want to look at. And then status, pretty self-explanatory. Do you want a list of just your active people, or do you want everyone? You can click check all. And then you can also do it by funding source. So that's what these parameters are. It's just, asking you who all do you want the report to pull back. And then you can choose your export type here. Do you want Excel, PDF, or Word? Most of them come through best in PDF at the moment. And then click Submit, and it will pull the report up for you. And I mentioned that little person icon earlier. I will show you that again when you're in an individual. This little person icon here. You can get to that case summary report for that individual user through here as well. So there are two different ways to access it. So when you click on that case summary, you just need the core ID. And then that's another way to access that case summary report. If there are any particular reports that you would find useful, please let us know. And also, again, if there's just kind of a one-off report that you want or some data that you're wondering about for your program, reach out to us and we can get you a list. We do have a new feature coming out next week, Wednesday, I believe it is. Next week, Wednesday, we will have a place for you to extract your data in Excel. So if you have a program evaluator or someone like that where they want all of your information, instead of having to contact us like you do now for that, there is going to be this core data extract tab, and it will pull back all the information for you. So that will be out next Wednesday. If you do have an outside evaluator, though, obviously you need to make sure all those agreements are in place so that you can give them that information. All right. Does anybody have any questions before we close out here? Someone's asking about jail days averted. Be consistent is my biggest response to that. How many days would they have served had it not been for entry into your program? Not seeing any other questions at this time. I will stay on the line for about 2 more minutes, answer any questions that come through. Otherwise, have a great day, everybody.